Putting in long hours at work may not be paying off in terms of your health. A study conducted in the UK of 6,000 workers over an 11-year period found those who worked 10 to 11 hours a day regularly are 60% more likely to develop heart problems. Those who occasionally work 1 to 2 hours of overtime showed no increased risk. So joining us via Skype to discuss this overtime study is Dr. Christopher Magovern at Morristown Memorial Hospital in New Jersey. Dr. Magovern, thanks so much for joining us.
Good morning, Tanya.
So, Dr. Magovern, chest pains, heart disease, even heart attacks, this is serious stuff. Should this study raise concerns here in the U.S. where so many people do work long hours?
You bet. Let's face it, Tanya, we work long hours in the United States. The average American works just under 2,000 hours a year. That's more than our counterparts anywhere else in the country. And furthermore, if you ask average Americans whether they would rather work a little bit more to make some more money or take time off, they universally would decide to work harder and make more money. That's just the way we're wired in this country. And unfortunately, the results of this study show that work ethic may come with a price. And as you indicated, this was a very sophisticated study that looked at 6,000 workers. These were middle-aged men and women that had no underlying history of heart disease. And they followed them over time. And once they balanced out all other potential risk factors, they found that those that worked longer hours had a 60% increased risk of having a cardiac event. And that's significant.
Now, what was the link between working long hours and the health problems? Do those who work longer hours tend to be or become more out of shape?
Well, that's exactly what you would think. You would think that the more you work, the less time you have to work out and the less good shape that you would be in. And interestingly, they found that that was just the opposite. The individuals, the men and women that worked these longer hours that ultimately had heart problems tended to be men and women that did not smoke, they drank only in moderation, and interestingly, they exercised more than their counterparts that worked only a 40-hour week. So it was just the opposite of what they found.
It's incredible then the takeaway seems to be on the surface, and correct me if I'm wrong, that the actual stress of the longer hours is what's to blame.
That's exactly right, Tanya. And what this paper did focus on, and I think is really the take-home message, is that the men and women that worked longer hours that got into trouble also, interestingly, were type A personalities. And they were also people that found their work more stressful. And this is critically important when we're trying to digest this study. Because stress, we know, and we've known for years, is a real risk factor for heart disease. When you are stressed out, your body produces hormones and adrenaline, and it makes your heart beat stronger and beat faster. And that can be helpful for certain situations. If you're in an argument or a fight, or you need to run away from something. But if you are exposed to this surge of adrenaline continuously, day in and day out, that can put a real strain on your heart.
Because these hard hours, these long hours, seem to be leading to, as we said, more stress, higher blood pressure. Is that the link, the stress and the blood pressure, or is it more than just that?
Yeah, that's a great point, Tanya. I think stress is the real link, and that's what this paper is all about. But blood pressure is very much a consideration also. Your blood pressure, as you may imagine, is directly related to your stress. When your stress level goes up, your blood pressure goes up. Did they look at this specifically in this study? No. But it's difficult to tease out blood pressure in a study like this because your blood pressure fluctuates over the course of the day. You may come to work and you may have a nice, calm demeanor and your blood pressure is low, but you may get into a confrontation with a coworker, or you may have a guest on your show that won't stop talking. Your blood pressure is going to go up. Right. And we know that blood pressure is directly related to heart disease.
Now, Dr. Magovern, I want to end on a note of advice for those who are sort of forced. There are so many people right now who maybe would like to work shorter hours, but they clearly can't right now with the economy the way that it is, or like you said, some others who do it by choice. Do you have advice for those who simply have to put in long hours?
Well, I do, and I think you hit the nail on the head there, Tanya. It may not necessarily be the longer hours. It may be the stress that comes with it that we really worry about more. Because, as you said, in this economy, people need to work longer hours, and they may be more stressed out if they can't work the longer hours. So I think the key is to minimize stress, and the way you do that is common sense.
Thank you so much, Dr. Magovern. It was a pleasure speaking with you this morning. The entire study can be found in the European Heart Journal. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.